Ready?
Yeah.
Mr. Cannon, can I come in?
Yes, ma'am.
Hi, my name's Erica. I'm going to be the student midwife doing your assessment today. Today we're just going to do an assessment of your joints, muscles, range of motion, musculoskeletal system, okay?
Yes, ma'am.
Could you start by telling me your name and date of birth?
My name's Cedric, and my birthday is June 30th, 1993.
And what year is it right now?
2023.
Okay, and where are we at?
Doctor's office.
Okay. So my client is alert and oriented to person, place, time, situation, and his affect is appropriate for the situation, and he appears to be well coordinated. So we're going to start by inspecting the upper extremities. If you could take your shirt off, that would be, if you don't mind. Thanks. So we're going to inspect around the neck, the arms. Everything appears proportionate there. I'm going to inspect the back. Everything looks symmetrical and where it should be lined up. So now we're going to do active range of motion with the shoulder, elbow, wrist, and the fingers. The shoulder, we could probably have you stand up. And active range of motion is where you're going to show me what you can do. So we're going to take our hands and like raise them above your head and bring it back down and behind. There you go. And let's try that with the other side. Good. Good. And then for a range of motion of the elbow, I'm going to have you just flex and extend both elbows. Good. And extend, flex and extend. Is there any pain while you're doing that? Pain or discomfort? Everything feels okay?
Yes, ma'am.
Okay, you can have a seat. And then we're going to assess the wrist. So we can start with pronation. We're going to have you turn your hands, and then supination, pronation, supination. And he has full range of motion of the wrist as well. You can also turn them out and in. Good. No pain with the wrist? Okay. And then the fingers, you can make a fist and extend, and also space your fingers out and bring them together. No pain in the fingers or anything like that?
No, ma'am.
Okay. Then we're going to palpate for any swelling, deformities, or crepitus. This way. Okay. And there's no pain. I don't feel any crepitus. I don't feel anything crunching or moving together like it shouldn't. So now we're going to test the strength of the neck, shoulders, elbows, and hands. So for your neck, can you just turn your head against my hand? And how about this side? Good. And shoulders, lift against me. Good. And the elbows. Just go against resistance and pull. There you go. Same on this side. And push. Good. And same for the hands. You can pull against me and push. Good. No pain with any of that still?
No.
Okay. Then we're going to do rapid alternating movements. You can put your hands on your thighs and turn your hands up and down quickly. Rapid alternating movements. There you go. And for this one, we could also do the touch your fingertips. Down and back. I'm not quite sure about the coordination on the right hand over there. And back. You got it.
I wasn't sure if I was supposed to touch the pinky twice or not.
Next, we can do finger to nose and finger to finger. So I'm gonna stand over here, and I'm just gonna have you touch your nose and
My
start
finger?
with. You can start with your left hand. Yes, touch your nose with your finger and touch my finger. Now nose, my finger, your nose, my finger, your nose, my finger. Good job. And the coordination was there with that as well. And then we're going to test for stereognosis, and I just need you to close your eyes.
Close my eyes.
Yes. I'm looking for something. Not a pair of scissors was the first thing that I could find. This will do. So I'm going to have you close your eyes and then put out your hand. I'm going to give you an object, and I just want you to know if you can identify the object. Okay? Close it, and are you able to identify what that is? What does it feel like?
Feels like a bobby pin.
Okay, it is a bobby pin. And then we're gonna test the reflexes. We're gonna start with the bicep tendon. So I want you to kind of, yep, and we're gonna find the bicep right about here above the AC space, good. And then relax your arms, I'm just gonna tap, okay? And with this, we should have contraction of the bicep. There it was. And this one right here. And relax. There you go. Then we're gonna do the triceps. So I'm gonna have you kind of hold your arm like a robot. Like if you're a robot, relax right there, and I'm just gonna hold here for support. And right above the elbow, we have the tricep tendon. So I'm just gonna tap there, and we're looking for contraction of the tricep. There, that's cool. And then we're gonna do the same thing on this side, kind of relax. Good. And then we're going to do the brachioradialis. So this is a difficult tendon to find just because it's not as prominent and easily felt as the other tendons. So we're going to have the patient rest with his palms upward and resting. And right above this bony prominence, right in here is where we're going to find that. And we have that upward contraction there. And the same thing on this side. Did you feel it? The next thing that we're going to do is assess for the pronator drift. So this is where we're going to have our client stand up.
Stand up.
Yes, please. And fully extend your arms and close your eyes and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And there was no drop in his arm or anything concerning there. He has equal strength on both sides. So moving on to the lower extremities, if our patient had their pants off, we would be able to inspect everything. You don't have to take your pants off. So we're going to do active range of motion of the hip. I'm going to have you actually lay on the couch behind me for this one, if you could. Move the chair out of the way. And this is where we're going to do the hip, knee, and ankle. On your back would be best. Sorry. And we're going to start here by having the patient abduct and adduct. So we're going to bring your leg out and back in, out and back in. You can go up and go down. Any pain with that?
No.
Okay, and the other side? I know it's hard because the couch. And back in, out and back in. We can go up and we can go down. Any abnormal pain with that?
No, ma'am.
And his strength appears to be equal on both sides. Sorry, there was a fly. With those. And the next thing we can do is bend the knee. And extend. Flex and extend. And same with the other side. we could also have him sitting and dangle his foot for that one as well. Good. And the ankles, I want you to down and back up. Good. You could go out and in. Any difficulty moving?
No, ma'am.
Okay, and how about this foot? Against me? Okay. You come this back. Also with that, I was testing the strength. He was able to push against me and pull it back in with his own strength. Also with this, we could move those muscles and palpate. I don't see any swelling that's obvious. No crepitus that I'm feeling. You can rotate that foot. I don't feel any crepitus in the ankles either. The next thing we can do while you're sitting down is the vibration test. I mean, laying down is fine. So we're gonna vibrate the tuning fork and we're gonna put it down here on a toe joint. And I'm holding behind, and I just want you to tell me when you feel the vibration fading away and when it stops.
Let's be stop.
Okay. And we're gonna do it on this side. Same thing, okay? If he wasn't able to feel that in the feet, we could try the vibration on his shin, or the kneecap would work as well. So I can have you move back over to the chair, please. This makes it easier to relax your legs so that they're hanging. And we're gonna check for patellar reflexes, the Achilles tendon reflex, and also the plantar reflex. I'm gonna sit down right here just so I can reach, and I want you to just relax. And right under the kneecap is where we're gonna find that patellar tendon. And that's when we have that flexion where the knee pops out. Same thing on this side. And there it is. We can see your hand in the video. So while I'm down here, I'm gonna check the Achilles reflex. So I want you to, flex your foot up, and I'm gonna just hold support on the back of his foot. And I'm gonna wash my face, and we'll have that downward curl of the foot. I'm gonna try this one. And then for the plantar reflex, he really likes this one. I'm gonna use the bottom part of my hammer and just rub it across, and it has that curl of the toe down. And this is the opposite of the Babinski reflex, usually present in babies, where their toes fan out. Thank you for that. Next I'm gonna have you do the heel shin test, and this is where we're gonna take the heel on one foot and rub it across the shin of the other leg. Just nice and slow, rub it up. Your heel against your shin. There you go, rub it up. And then back down, nice and slow. Good, and we would have concerns if he had any inability to keep his heel onto the shin, but his coordination appears to be very well. Same thing on the other side, up. Sorry. And back down. Good. The next thing that we can look at is spine and balance. I've already kind of been assessing his balance while he was walking. He was able to walk. If you want to stand up. Now I'm inspecting his posture, the alignment of his extremities. His shoulders appear to be even. His legs appear to be the same length there, and his spine appears to be nice and straight. I don't see any protrusions or deformities in the spine. So the next thing I want to do is inspect your gait. So I'm just going to watch you walk usually about 15 feet, just a regular walk. And back to me. You can do a heel toe. Good. Good. And then if you want to turn around and walk back on your heels, heel walking, only on your heels. There you go. And coming back on your toes. Good. Then we can do active range of motion of the spine. So I'm going to have you bring your chin down. And I'm looking up here. I don't see any protrusions or abnormalities there. Lift your head up and back. Is there any pain with that?
No.
Then I'm going to have you kind of bend in the middle. Any pain there?
Nope.
And back, and then all the way down. Good. And here I'm also looking at the spine. I don't see any protrusions, no abnormal curvature. One side does not protrude any more than the other back here. And while he's down there, we can also do the test for scoliosis, where he just leans forward at a 90-degree angle. And I can feel down his spine. I don't see any asymmetry, and his spine feels pretty straight. And next we can move on to the Romberg test. And we're gonna stand up with good posture, eyes closed. And we're just looking for any swaying. If we had concerns that our patient was gonna fall over, we could kind of put our hands in front of them and behind them just in case they move forward. And I don't see any swaying or any signs of concerns there. So overall, no concerns, no pain.
No, ma'am. Oh,
Okay.
I want to show you.
All right, and I think that is the end of our assessment. Thank you very much.